So standing here tonight, finally, by the way, at this moment, I experienced the sensation of what it must feel like to sail into a safe berth after a wild storm. Of course, after the calm of our wonderful leadership reception, we'll pack up and sail back into the deep waters. It's been a tumultuous journey, but we have quite a few nautical miles yet to sail together. All of us in the community, behavioral health community, are experiencing the pace of a rapid transformation of all that we do in an incredibly telescoped time frame. Donna, you've said all of this, but in different words. I should probably just say ditto and sit down, but I can't help it. I've got to do it my way. As we rush toward an uncertain future, we're haunted by the potential destruction of the community-based safety net, built up over the course of at least 30 years. Yes, that's a dramatic worst-case scenario, but the very axioms we have functioned under are changing fundamentally. We have an enormous set of tasks to accomplish in a short time, and we haven't much room for error because many vulnerable adults, children, and their families depend on us. Geriatric homebound clients depend on us. Troubled adolescents depend on us. People who have addictions and substance use problems depend on us. As many of you know, I can be quite direct. Our colleague Ellen Josem put it most kindly recently as refreshingly direct. Lately, I have been responding to friends' questions about how work is going with the 4 F's: frenetic, frazzled, fractured, and frantic. So now I've said it, I'll stop whining. I do think the challenges facing us today are unprecedented in our time, certainly in my 17 years in this work. We are laboring in a polarized political environment on the federal and state levels. We have a huge budget problem everywhere. These problems are driving the force behind our policy transformations and a shrinking service delivery system. Like all challenges, they present opportunity as well as peril. We have the chance to recreate ourselves. I wish it were happening in an economy of plenty rather than one of scarcity. I wish transformation were not driven by fiscal pressure, and I wish that we only had enough time to test our theories on the ground and pick only the best and most successful strategies. We have neither the space nor the time to do one major project at a time and make sure that it's right. So we must wade into the waters of change. The former Chrysler tycoon Lee Iacocca gave some wise advice that he followed himself. In times of great stress or adversity, it is always best to keep busy, to plow your anger and your energy into something positive. We will work, the coalition will work toward a changed system that also reflects our highest values. We are deeply involved in the formation of behavioral health organizations. Many of us are enmeshed in the creation of health homes, envisioning behavioral health homes and medical homes. We are thinking hard about accountable care organizations and RIOs and all those acronyms that you've heard tonight over and over. At the same time, we are contemplating how all these entities are going to interact on the ground and result in a seamless, integrated system of care for our consumers. We are developing electronic records that can speak to others across agencies and government lines. We are doing it with very little financial assistance. And most profoundly, we are on a swift trajectory toward managed care. Managed care for all. Medicaid recipients, and who knows what other services will be brought into the system that managed care embraces. We are collaborating among ourselves and with our allies. We are reaching out to others in the healthcare community and creating new alliances. What exactly will the future look like? What exactly is our destiny? These are the questions we are urgently seeking the answers for. Through local organizing, participation on public panels and committees, analyzing policy and examining different models around the country, and pounding the pavement of the Capitol and City Hall, we are trying to contribute to the dialogue and formation of public policy that will get us to the next stage and next destination. We have at this stage many more questions than answers. We have a vision, but we cannot avoid a focus on the practical matters of payment, regulations, multiple oversight, unfunded mandates, and overbearing audits. We do know that we want to move toward a care system that is holistic, one that empowers our consumers to have choices about their care, one that focuses large energies on prevention and wellness, one that inspires hope and encourages recovery for all of our consumers, and one that involves peers in the provision of care as an inspiration and model for their fellows. All of the above describes our current journey. We could not embark on the difficult and unknown passage without the inspiration and support of the incredible members of the coalition and the leaders of the coalition. As for our board and committee chairs, the coalition couldn't ask for better minds and better hands to navigate the challenges. We also owe a big thank you to the incredible coalition staff who work and work and work at steering and powering the ship. Thank you to Pat Gallo-Goldstein, who stands out as prime leader in our ranks. Thanks to Ashraf Siam, our new CFO, and Nancy Bradshaw of Finance and Administration, Jason Lippman, our new consummate advocate, and Heather Mermel for lots of potent and informed advocacy, to Karen Krampitz for superb learning experiences and trainings. Thank you to Chris Bianchi for organizing my distracted work life, and to Grace Mercado for her support. The center staff has helped educate us all about the landscape of recovery. Thank you for all your work to Dr. Courtney Harding, our leader. Thank you for all your work to our wise counsel, Aaron Vieira, Susan Blair, Pat Feinberg, Deborah Short, Timothy Joseph, and Margie Stryker. I am so grateful and so lucky to have you all on our team. Finally, as our honorees tonight have demonstrated, the coalition could not achieve success and even small victories without our fellow advocates, especially without our partners in government. We argue a little, we debate a lot, we struggle with the pushes and pulls of a relationship that demands some adversarial stands on ideas and policies and lots of cooperation toward the fulfillment of our joint commitment to our shared constituents. Thank you for your hard work, too. Ultimately, we stand together in facing the formidable challenges ahead of us. Martin Luther King may have said it most eloquently when he said what I paraphrase here: the true measure of people is not how they behave in moments of comfort and convenience, but how they stand at times of controversy and challenges. Thank you for coming tonight. Thank you, Pfizer. Let's keep it going.